Hi, my name is Taylor. I'll be your physical therapist today. Can you tell me a little bit about what happened?
Well, I was driving on the road and this old lady was driving behind me, and I know that every time I get behind an old lady, I just get worried. And so she hit me in the back. She hit the back of my car, rear-ended me, and I whiplashed. That's what the doctor said. I have some kind of whiplash. And so I can barely move my neck. It just hurts so bad.
Okay. And tell me a little bit about that pain. Can you tell me where exactly it is?
It's just all in my neck area, in the back though. In the back of my neck.
In the back of your neck. And if you had to rate your pain on a scale of 0 to 10, 0 being no pain at all, and 10 being rush you to the hospital, worst pain in your life, what would you rate it?
I'd say it's probably a 5 right now.
A 5 right now.
Mm-hmm.
Okay, and does anything make that pain worse?
Not really. Nothing really sparks it up. It just hurts all the time right now.
Okay. I'm going to take a few measurements on you if you don't mind.
Okay.
I'm just going to test your range of motion.
Okay.
All right, and can you bring your ear to your shoulder, please, for me? All right. And then can you take your other ear to your other shoulder for me? All right. And then I'm going to have you bring your chin to your chest. Oh, don't go too far if it hurts you, okay?
Okay.
And now can I have you bring the back of your head to your back? Don't go too far. All right. And I'm going to have you look over to my hand over here. Can you see it?
Yeah.
Just keep going. All right, and can you look the other way for me? Good. Thank you very much. You are pretty limited, so you might be kind of tight. Is it all right if I ask you a few questions?
Yeah.
All right. So I'm just going to go over a few contraindications to something that I think we might try. It's called traction. I know some people have heard of it. They think it's kind of scary, but it shouldn't be scary. Let's see. Can you tell me about how long ago this happened?
It happened about 2 weeks ago.
2 weeks ago? Okay. That's good. And do you know if you have any blood pressure problems? Do you have high blood pressure? No? All right, and I'll give that a check as well. Have you ever had traction done before?
No.
You haven't? Okay. All right. And then, let's see. Do you have any joint diseases like osteoporosis or rheumatoid arthritis that you know of?
No.
Do you take any steroids? All right. Have you had an MRI or CT scan of the spine?
The doctor did a couple of things, but I don't think he quite did that kind of stuff. I don't really understand what that is, so no.
All right. Do you know if you have anything such as Marfan syndrome, anything like that? No disease.
No diseases.
Are you claustrophobic at all? All right. Have you had any recent surgeries in the area of where your pain is? No. Okay. And are you able to lie on your back comfortably?
Yeah.
Okay.
It's the best way right now.
All right. And do you have any problems with your TMJ joint? That's the joint right here. Any problems chewing or talking? All right. So I'm thinking that we are going to do traction. I think that'll be the best option for us. Some things that may happen to you are your pain may increase a little bit, which, you know, sometimes that does happen, but we will take care of it if that does happen. You may have new symptoms. You may have numbness and tingling. Just be sure to let me know if that does happen.
Okay.
You may have pain at another level in your spine. And again, just make sure to let me know of anything happening. And all of this can be avoided, and I will make sure to take all precautions of doing that.
Okay.
All right. Do you have any other questions?
No. Let's go ahead.
All right. Awesome. Well, let's go get set up.
All right.
All right. I'm going to have you sit right up here for me. Is that all right?
Yeah.
Just be careful.
Okay.
First, I'm going to take your pulse. All right, that's good. I'm going to take your blood pressure. And that's good. So you're set. I'm going to just test your sensation really fast. If you could close your eyes for me and just let me know where I'm touching you, okay?
Okay. On my right side of my right hand. On my left side of my left arm. On the inside of my right leg. On the outside of my left leg. On my right side by my neck. On my left side by my neck. Right behind my neck.
All right, good. Now, is it all right if we begin with the procedure?
Yeah.
Okay. What I'm going to have you do is lay on your back.
Okay.
These little black knobs right here are going to fit on your neck. It's going to go on the bone right here behind your neck. I want it to feel just like that, okay? So just let me know when it's comfortable for you. Well, be careful. There you go. You may have to scoot up just a little bit. Got it?
Yeah.
All right. Does it feel like that's on there? You need to go a little tighter.
Yeah, it feels good.
All right. And what I'm going to do is I'm going to place this towel right over your head, and it'll be there for protection.
Okay.
And then I'm going to place this strap over that, and that'll just help with the treatment. Is that comfortable?
Yeah.
Okay. Now what I'm going to do, since you said that you've never had this done before, I'm just going to set it on certain parameters so that it's comfortable for you.
Okay.
We have this switch right here. If at any time you feel uncomfortable, you feel pain, you feel numbness, that's abnormal, anything like that, you just press that button and it will stop, all right?
Okay.
All right. Just going to make sure there's plenty of tension in this rope. There we go. You feel all right?
Uh-huh.
Okay. So we're going to get started. And just let me know if you feel uncomfortable or if you're in pain. Just let me know. I'll be right here by your side.
Okay.
Starting to feel it?
Yeah, a little.
All right. It's just going to slowly climb up and it's going to progress, okay?
Okay.
It's working its way up. And so what this is doing is I have it set on about 8 pounds of pressure. So it's pulling your head up about 8 pounds worth of force.
Okay.
And since you said you have whiplash, this is pulling your tissues, like your muscles and your joints and everything.
Mm-hmm.
It's distracting your muscles and pulling your muscles apart. And what it is doing is it's stretching them out and healing them by distracting them, and it's helping them to stretch out, and it'll help you feel better.
Okay.
There's different settings that we can work on at a later time, but since you said that it's your first time with this, right now we're just starting with something that is called static, and that's something that we try out just to make sure that our patients are comfortable with it.
Mm-hmm.
At a later time we may try what's called intermittent, and that will have a hold time and a rest time that doesn't pull as much. So that's something we can try if this does work out for you.
Okay.
And are you feeling okay?
Mm-hmm.
All right. How's your pain right now?
It's a little better.
A little better, okay. We don't want it to be too much better. We don't want it to completely go away. So just let me know if that happens, because that means that we may be injuring something else.
Oh, okay.
Don't be scared by anything, but we don't want anything to happen.
Okay.
We're gonna do this for about 5 minutes.
Okay.
You're still feeling okay?
Mhm.
All right. And it's been 5 minutes. And we're slowly gonna let that be relaxed. And do a release. Alright. And you can, I'm gonna let this go. And just slowly sit up for me.
It feels better.
All right, now what I'm gonna do is I am gonna test your sensation again. Can you close your eyes for me? And just let me know where I'm touching.
On my right side of my neck. On my left side of my neck. On my right jaw. On the back of my neck. On the inside of my right leg. On the top of my left leg.
All right, and then on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever experienced, what would you rate your pain now?
Probably about a 3 now.
A 3?
Yeah.
Okay. And I'm going to take your pulse again, just to make sure that you're doing all right before we get you up all the way. That's good. And we're going to take your blood pressure. And that's pretty good. I'm going to have you go through the range again. If I could have you stand up for me, just take it real nice and slow. Going to have you sit in this seat right here. And if you could put your right ear to your right shoulder for me. And then put your left ear to your left shoulder for me. Good. And then I'm going to have you look over here to my right hand. And then look the other way for me. All right. Now can you put your chin to your chest, please? And then bring it back up. Good. Well, you definitely have better range, so that's a good sign. So next time we may try what I told you about the intermittent, which would be a different time range of pulling on your neck and then releasing it a little bit, but you'll still have some pull. So that's something we can try. We can also try some exercises to help you stretch out your muscles and help with the pain a little bit. And we'll see what we can do.
Okay. Sounds good.